So United Nations Special Rapporteur on Health Rights, that's Dr. Tlaleng Mofokeng, believes that the COVID-19 pandemic has exposed underinvesting and a lack of agility in healthcare systems. She says facilities have been underprepared to manage complex emergencies, often impacting on the delivery of other services. For more on those insights, let's bring in the doc now, who joins us via our video link. Dr. Tlaleng, always great to see you. Thanks very much indeed for making time. I think many will agree that people living on the margins of our society often bear the brunt of health failures. Do you think our authorities, our decision makers, are alive to that reality as we plan our vaccination drive?
I think it is important to acknowledge that this pandemic has really compounded existing inequalities in society in general, but has also exposed some of the real challenges in the public as well as private sector. But I think most of us, our concern usually lies with the public health sector, because we know that is what services the majority of the people in the country who often cannot afford to outsource their healthcare to the private sector. And we know, in fact, that the right to health does not only speak to the access to actual health facilities, but also encompasses the right to underlying determinants of health, such as hygiene, safe drinking water, access to electricity, and as well as health information that's really key to enabling patients and the citizens at large make informed decisions.
Yeah, already we're seeing the data starting to paint quite an interesting picture. For one, we're being told that a fifth of those in our country who are insured have received a COVID-19 vaccine, while only 6% of those without insurance have done the same. It's still early stages, many might say, but it is pointing to quite an interesting dynamic, isn't it? Firstly, what do you read into that? The fact that it appears a whole lot more people who have insurance are coming forward for a vaccine versus those who don't.
I think it speaks to a few things. It speaks to a state of readiness in terms of having facilities that have the capacity in terms of human resources, but also have the capacity in terms of the actual physical structures required to be able to do social distancing and other important behavioral and preventative measures that public health systems have, we've been told, are unable to really just they have to be readied and become vaccine sites that are certified first, and that process is also taking a bit of time. We are more than a year and 6 months into the pandemic. We've known since last year March that in fact vaccinations were the only way we're going to come out of this pandemic, and yet we are told that public health facilities are still being readied. The other issue that it points to in terms of the numbers in the private sector is that it was earlier this year that there was a court case that some members of the private sector were taking the President and the Department of Health to court in terms of wanting to procure vaccines for their own. And I joined that court case and provided an expert affidavit speaking to this very issue of inequity, that we cannot have a rollout that is based and the access to which is based on whether you have economic means to firstly afford medical insurance and then now be prioritized. And we've seen how that replicates in terms of service delivery, that the private sector will still be better only because of the financing and how they have managed to really be, I suppose, step ahead in terms of government. But it doesn't mean that government has no capacity. It's just that we know that the public health system has been riddled with maladministration for many, many years, bringing it to its knees. And COVID is just exposing that. And we know the issues of corruption as well that are currently, embattled in the department. And so we know that you can't have a progressive and an active and decisive leadership when you are at the same time not transparent and not taking action and holding people in positions of leadership accountable.
It's exactly It's exactly what we had feared, isn't it? The fact that this kind of pandemic will worsen inequalities, not only in a country, continent like ours, but certainly around the world too.
Absolutely. And this is why when we talk about the vaccine equity, we also speak about the fact that the global north and the richer countries have been hoarding vaccines, but they've also been blocking really critical intellectual property and the scientific know-how that will enable other countries outside of the Europe and the North America to be able to produce their own vaccines and distribute locally and in terms of the region. And hence the latest, Save Everyone campaign on social media and across other platforms, really demanding of government to think and place the people with comorbidities higher up on the list that we cannot use age as a determining factor when you are dealing with a pandemic that we've all known and accepted, and based on science, that it's the elderly and those people with comorbidities that are mostly at risk of hospitalization and death. And yet in our own rollout in this country, they have now changed that public health, very key knowledge, and without really telling us why did the government take a U-turn in terms of prioritizing people with comorbidities. And a month ago, they took away a circular that had proposed to really prioritize business people, sports people, embassy and civil servants and politicians. And just this week, that circular is back. So we can't, on the one hand, say the citizens must do everything that they can to do all of the behaviors that will prevent COVID, and yet in the same breath, the government is doing everything to show us, firstly, that they not quite know the very, very basic principles of public health, not in how they communicate around this vaccine rollout, not how they've communicated with COVID from the get-go, and how they've really left a vacuum for misinformation to happen. And it's unfortunate, right, that our third wave coincided with our really ramping up of the vaccination, but there isn't no information that is credible, that's in the public domain in all of the languages where people can understand what's happening between the vaccination rollout, the third wave, and some of the deaths that people are now, experiencing.
Yeah, you speak about a list of priorities. How high up that list do you think something like vaccine hesitancy should be for our response to the pandemic itself? And I'm asking this on the back of what many people might interpret as an increasingly rigorous anti-vax movement, for lack of a better term, especially on places like social media.
Look, effective use of information is really the foundation of modern public health practice. And of course, in the time of outbreaks, but also generally in public health systems across the world. And what has happened is that we have allowed politicians, we have allowed people who are not scientists and not experts in the field to be leading in terms of communication. And that communication is often devoid of science and it's devoid of research. And what has happened is that social media has now taken over what should be actually centralized information that is really, broken down into units that people can understand in a way that people are able to engage with that information to be able to make informed decisions for themselves on a daily basis, but more broadly in terms of all of us as a society and a community. And I think increasingly, patient-driven world of healthcare is the reality. And we cannot ever find a way or a time where patients are not asking for more information or are not on social media. What we then need to do is use for example, the government central information system to be able to disseminate information. Government has been able to mobilize funds for all sorts of, activities during this disaster time, which we are still in. And I think information, science-based and research-based information is something that we are lacking. And in order to then turn the tide around misinformation and hesitancy, we have to be open and honest and make sure that we are able to give people information, which is their right, by the way. Part of the right to health entitlements is health information, to be able to give consent when you are having health care as well as make informed decisions.
I remember it must have been a few months back now, the World Health Organization warning that we mustn't allow COVID-19 and this pandemic to be a gateway for other pandemics because of the way in which the virus has put other ailments on the back burner. How concerned are you of something like that happening, or is it a little too late to even ask that question now?
It's never too late because we are talking about life-saving decisions. We are talking about governance and leadership within the public health system that has to be decisive and transparent. But we are also talking about a healthcare system that has relied for many decades on the backbone of healthcare providers who themselves are mentally exhausted. They are physically exhausted. And we know many on a daily basis are dealing with prioritization, even outside of COVID. What COVID has now done is say that even with the little resource that the medical professionals were dealing with on a daily basis, those are stretched to the bare minimum. And what is now happening, for example, in some hospitals, elective surgery has been postponed with every wave, with every, level 4, level 5. All of those did not only mean we were just not physically outside partaking in political or social settings, it also meant the hospitals themselves had to delay, often life-saving, even though they are elective surgeries. And we have a lot that we still have to do in terms of South Africa and quantifying the amount of comorbidities that have been mismanaged. We know early on, many of us were concerned about the lack of contraceptives and condoms that were available in public spaces that were usually available. Many of us are still worried about the chronic management, right, of HIV in terms of accessing your regular ARVs, but also conditions such as diabetes, such as hypertension, such as asthma. And again, we can't talk about these comorbidities and then not prioritize this very group of people when the vaccine rollout is happening. This is what we are concerned about, is that the world over, even the WHO has given these very clear guidelines that our government isn't following. And we need to know why, because these are about the lives of people every day. And many of these deaths are preventable around COVID, especially because of the delays in getting vaccines and because of the greediness of the global north countries and the richer countries. But we do have to really look deeper in terms of our national plan and how we've responded to this pandemic. And we can't do that, of course, without being honest and transparent to aid accountability at the end of the day.
Right. Of course, the complexity doesn't end there. Our, call it, dysfunctional immigration regime has also raised a lot of questions about how we can ensure that no one is left behind. Currently, I've yet to hear a coherent message around whether or not undocumented migrants in this country are even a consideration in our vaccination drive, which would be concerning if they're not, because we know no one is safe until everyone is safe.
Absolutely. And South Africa has a very disturbing obsession with fellow Africans. And it's really something that we have to be honest about as a country. It affects how we plan. It affects, of course, how we prioritize certain communities over others. It affects how and who we seem worthy of development. And in this case, it has affected who we think is worthy of life and life-saving science. And again, I take us back to the human rights principles of public health. The right to life includes saving everyone's life. There is no such thing as an illegal person. We are all on this planet, on this earth. We may have, different nationalities, but you are dealing with a global pandemic. This is not a time to be Afrophobic and to further assert ourselves as a very xenophobic country. And the principles are very simple. You vaccinate everyone who wants a vaccine. It's very, very simple. It doesn't depend on age, on class, on race, on gender, on geographical location, or even your migration status. It doesn't depend on that. Everyone who needs and wants that vaccine should be able to get it. Of course, we understand the constraints, but we cannot use age that is not based on any scientific knowledge or guidance at all for our vaccine program. And of course, in the beginning, we understood that people were over 65. It was important because the guidelines are that they were most at risk. But to then keep people waiting to get a vaccine, those who are below the age of 35, the time between now and September is a full-on 4 weeks. And you are saying people must just now wait using an arbitrary, measure. And I don't think that's fair. And the same with fellow Africans, because a lot of these, issues and concerns about migrants, it's really about Black people. It's about continuation of exclusion and of policing and punishing Blackness. And I think we really have to think as a country about what it says about us, but also, again, showing that we do not know much about public health and the right to health principles. And it's very sad if we are going to keep excluding, not only in the economic sector and the social sector, but now we are using the health system and we are weaponizing migrant status as a means to either allow people to live or die. Yeah.
Well, very quickly, Doc, we're told now that the bottleneck, the issue of vaccine supply has now been sorted. Millions of vaccines arriving just days apart, we're told. How should the government, insofar as you're concerned, now move forward with their efforts, one would hope, to try and ensure that at least the risk of this virus is mitigated as quickly and as efficiently as possible?
I think we need reporting of how many public health clinics and hospitals right now are vaccine sites, so that we know out of the total number of facilities in this country, how many are actually operating and functional as vaccine sites? We need to see a plan that's detailed on how we are going to, week on week, every single day, ensure that the rollout includes, the priority should also be training and making sure that the sites are vaccine, compliant, and that they can be able to store them and make sure the supply chain management is happening well. I think it's important that we move beyond just the number of people tested, how many are positive, how many deaths. We've had now more than 15, 16 months in the pandemic. Our stats need to be a little bit more detailed, so we know in which particular districts are we having particular issues of either vaccine uptake, and secondly, having misinformation, but thirdly, knowing exactly the type of comorbidities are there. South Africa has Stats SA, we have censuses, we have the health data, we have the death and birth certification. We need to be using all of that data for us to now start being a step ahead of the pandemic. We can't always be reacting. It's really now, we've had enough time to start getting these things right. And at the moment, I think what's really, really important is to prioritize, of course, strengthen the public health system facilities, but also give the public information. Because when a government is not transparent, the question is, what are you hiding? But when you are transparent, when you report and tell us, is it men or women who are dying? Is it more black women, or who is dying? So that when you then say you are prioritizing particular geographical areas, we know that that is enforced, and it is, you are being driven by research and by science and by emerging trends. Right now, we are not sure what is actually supporting some of these decisions. Yes, there are all these ministerial advisory committees and the vaccine, advisory committee. But what are they saying? What are the advisories that they've been giving? How many of those, have been taken on by the government? And those that were not taken, why were they not taken? So I think there's a lot in terms of data, in terms of how we can use data to get ahead of the pandemic. And I think, of course, like with everyone knows, and as experts agree around the world, the vaccine program will only succeed if we are using public health evidence and we are ethical in how we treat people who are in this country, and we cannot use arbitrary measures as gatekeeping for life-saving medicines.
Right, loud and clear. Dr. Tlaleng, great very much indeed to speak to you. Really appreciate your time tonight. UN Special Rapporteur on the right to health, Dr. Tlaleng Mofokeng. Once again, thanks very much indeed.